Good day, everyone. This is Dan Duncan, Vice President Impact Strategies at Community Technology, a firm that sells web-based software to nonprofits and funders to help drive their impact and results. Today's webinar is about asset mapping versus needs assessment, strategies for greater impact. And the webinar is based, for those that have not been on my webinars before, is based on my 30-plus years as a funder, as a United Way professional. In addition, for almost 20 years, I've been a faculty member of the Asset-Based Community Development Institute at Northwestern University. Some of you may be familiar with the work of John McKnight and Jody Kretzmann. But the work is based on how do we focus on the resources, the assets that we currently have in a community, in a neighborhood, and unlock those assets for greater impact and results. So this webinar will be based on my work as a United Way professional, as well as my involvement with the Asset-Based Community Development Institute. Again, this webinar is being recorded, and if you have any questions, please feel free to type them into the question box, because we cannot unmute your phone because of the number of people that are on the webinar today. So with that, let's jump in. So the objectives today, I'm going to talk about the difference between asset mapping and needs assessments. I'm going to drill down on the principles of asset-based community development and how does that help drive impact and results, and talk about how to utilize asset mapping as a key strategy to do our work, and give you a couple of examples from my work at the United Way of Tucson in southern Arizona, where I was most recently, and a little bit at the end about technology as a tool to help increase community engagement and results. But before we get started, let's do a couple polls just to see who we have on the webinar today. So it appears that the polls are not working today, so we won't do that. But if you do want to type into the question box, is your organization a United Way Community Foundation or Health Foundation? And how did you hear about this webinar? That would be great. Just go ahead and type those into the question box, and I do apologize, for some reason the polls are not working. So if our goal is to create significant measurable community change, there's a couple of assumptions I wanted to start with to talk about. The assumptions for greater community impact. First of all, that effective organizations are learning organizations that know how to effectively collect and use data to make the mid-course corrections necessary. So that's one of the key assumptions, is that we do need to become learning organizations. The second assumption is that it takes a wide variety of strategies and activities to achieve community change. No one institution, no one organization can do it alone, and it takes what we call both care and service if we're going to be effective. Service is what organizations provide. It's what we fund as funders, is primarily services, but it also takes care. And what we mean by care is the engagement of community residents in the work. And that's what this webinar is about today, is to a large part, is how do we unlock that care to be more effective. The second thing, or the third thing, is we need to be able to measure the impact of everything we do if we're going to be effective. So we have to measure both at the community strategy and the program level the results of what we're trying to achieve. One of the other things I like to think about as a way to think about this work about effective strategies is the work of Elizabeth Shore. Some of you may have heard of her. She's a professor at Harvard, and she's written a number of books about effective strategies. And a speech she gave in 2008, she talked about 5 key ingredients. The first one is that we need to be clear about the purposes of our work, the outcomes we're trying to achieve. So we do have to set those North Stars and be clear about our outcomes and objectives. 2, we must be willing to be held accountable for achieving those purposes. So accountability becomes key. The third is we need to create and sustain the partnerships necessary to achieve these purposes. Because again, no one institution or organization can do it alone. It takes partnerships if we're going to be effective. The fourth is that we need to move audaciously into the world beyond programs. This is where she's talking about that whole concept of care and service, that we need to engage neighborhood residents. We need to engage people in the work that we're trying to achieve. And then finally, we have to have the capacity to take community-wide responsibility to assure that the actions that will lead to improved lives will actually happen. And this is where it becomes important for funders to play a role in setting those objectives and working to make sure that the community is aligning around those issues and that we are being effective in the work that we do. One of the reasons for this, why the importance of care and service, I want to just take a few minutes on. Again, a couple of you may have been on my webinars before and heard some of these things, but most I did check, and the majority of individuals had not been on this webinar before or heard any of these webinars, so I do want to highlight some basic information. John McKnight from the Asset-Based Community Development Institute gave a speech in 2009 where he talked about the limitations of institutions. That there are limits to what institutions can do, and that's why it becomes so critical that we have care as well as service, that we have people engaged in the work as well. Michelle Obama talks about the same thing in some of her work, where she talks about, we used to think of volunteerism or community engagement as just the icing on the cake, but it's more than the icing on the cake. It's actually a key ingredient. And part of the reason for that is there's some things that if we're going to get the results we want to achieve, there are things that only individuals can actually do. For example, the primary source of our health. If we think about the determinants of health, according to the World Health Organization and other research, there are 5 key ingredients or 5 key determinants of whether somebody is healthy or not. The first one is personal behavior. People that do exercise, that they eat right, that they watch their weight. All of those kinds of issues will have a key ingredient or a key determinant of whether somebody is healthy or not. So that is a key ingredient. The second one is social relationships. People that are connected, that have social relationships, tend to be healthier than people that are isolated. That's why, again, strategies that I'll talk about later around seniors staying active and independent requires social relationships as a key ingredient. I was also listening to an MD, a doctor, give a speech once, and one of the things he talks about, he runs personal choices. At the end of that run, one of the things he does is he always calls one of his friends or relatives on the phone, because he knows that magnifies the value of his run for him because of the social relationships, and it also allows his friends or relative to have some vicarious benefit from his run. The third is the physical environment. If somebody is homeless, if they live next to toxic issues, they are more apt to have health issues. So the physical environment matters. The economic status is a key ingredient. Again, unfortunately, there is an inverse correlation between income and health issues. So the lower income people do have more health issues. Primarily that's because they can't make some of those personal choices of buying healthier foods and those kinds of things. And the fifth is access to health care. That's the least important, but that's the one we tend to spend the most time talking about. It is very important that everyone has health care, because if they break their leg, if they have cancer, if they have a disease, they absolutely need access to health care. But if we're talking about healthiness and making sure that people are healthy, these other 4 ingredients have a much larger component of people being involved and engaged to help do that. So that's why it becomes so important that we have both care and service. A couple others: safety and security. Basically, in a neighborhood, if there's crime, the police come too late. And so that's why it's important to have neighborhood watch and engagement programs so that people are more engaged in their neighborhood. Neighborhoods are safer where the neighbors know all of their friends and know their neighbors. There was a story of a woman at one point where she came home from working one night, opened her door, and everything was gone from her home. Everything was gone. She called the police. They came too late. The police then came. They interviewed her neighbor and said, "Did you see anything suspicious?" And her neighbor said, "No, I didn't see anything suspicious. All I saw was a big white moving van come up to her house and load everything from her house into the van. And because I didn't know her, I'd never met her, I just assumed she was moving." So the very act of having a relationship, if they would have known each other, a neighbor across the street next door, the chances are they would have known that she wasn't moving, that she was being ripped off, and they could have called the police, and maybe they wouldn't have come too late. So that safety and security, to a large part, is driven by community engagement and neighbors knowing neighbors. The future of our earth, the environment, that's critical. Again, people play a critical role in that, building a resilient economy. People have a role to play around that, and certainly raising our children. There's a key adage around that from community building, which highlights that to help kids be safe and succeed, children do well when their families do well, and families do better when they live in supportive neighborhoods and communities. So there is a role for people to play to help raise children. We can't just wait until kindergarten or first grade or for school to educate kids. There's a role for the neighborhood, a role for the community to do that. So, and then finally, again, as I've highlighted, is that only individuals can provide care, and we need both care and service if we're going to be effective in the work we do in creating greater community change and community impact. Again, if you have any questions during the webinar, please type them in your question box, and I'll be glad to respond to them. So again, please do that. We can't unlock the phones, so please feel free to type in any questions you may have during the webinar. So the difference between needs assessments and community assessments, let's drill down and talk about that a little bit. The first thing, based on my experience, some assumptions about needs assessments. First of all, we already have more data than we can use effectively. We already know what the issues are, we know what the concerns are, and we have, again, from census and other school district data, we have a whole host of data, more than we can actually use. And I think we would all agree that you cannot use data alone to decide if one issue is more important than other. For families, that if they're dealing with unemployment, they have a variety of issues that are occurring, and we can't say that one of those issues is more important than another if we're going to achieve results. So the barrier to change is not a lack of data, but the real impact is the barrier is a lack of leadership and a lack of community engagement. And needs assessments do not create leadership or engagement. And that's why it becomes so important that we begin to look at other strategies beyond just needs assessments according to kind of my work and perspective. So let's talk about engagement a minute. Engaging the community, what does that mean? First of all, it's not based on an opinion poll or a needs assessment. Just asking for people's input is not engagement, and I'll talk about that a little later. It's not about organizing the community to care about your agenda or the issues that you've identified. It's really what engagement is about, is identifying the individuals that already care about the issues that you care about and mobilizing their action. So whether that's education, income, or health for United Ways, or other issues, it's not about trying to convince people the issues are important, using data to do that. It's about finding people that already care about the issue that you're concerned about or the issues and mobilizing their action. And we'll talk a little bit later in the webinar about how to do that. So if we think of a needs assessment, this is a typical needs map from a community. And so if we do a needs assessment, we find out that there are all of these issues going on: illiteracy, unemployment, poverty, teen mothers, a whole host of these kinds of things. The fact is, these occur in every neighborhood and every community in our country, and we didn't have to do research to find that out. And the problem is, if we only look at these issues, if we try to drill down on just the negative issues, the scars, if you will, in a neighborhood, it has some consequences around that. The first one is it internalizes the deficiencies identified by local residents, so that people begin to define themselves by what's wrong with their neighborhood, what's wrong with their community. It has the ability to destroy social capital, because if you keep telling me how bad my neighborhood is, the crime rate, those kinds of things, then people may not go next door and meet their neighbors because they're afraid. So it has the ability of destroying social capital, as if all we follow and all we focus on are the needs. The other issue is that it leads to categorical funding flows, because typically what we do is, when we've identified all these issues, is we then try to develop individual programs to focus on each one of these. And as I highlighted earlier, typically people or individuals and families don't have just one of these issues, they have multiple issues. So designing individual programs may or may not be the best way to address their concerns or their issues. It also directs the funds towards the professional helpers and not the residents, because our solution, when we do a needs assessment, we think more in terms of new programs and services rather than also supporting care. And it also focuses on leaders who magnify the deficiencies. If all we're looking at are the needs, then the most successful leaders are ones that can propel their needs. And so that really reinforces the wrong type of leader, if you will. So in summary, it rewards failure, produces dependency, and creates helplessness when that's all you look at in a neighborhood are all the problems, or in a community all the issues or concerns. The fact is there is another map, and that is the asset map. And that's when we begin to also look at what resources do we have to address the issue, whether that's the gifts of the individuals, the skills, the abilities of the youth, the seniors, the artists, the labeled people. And what I mean by labeled people are those individuals that we've kind of labeled as either being homeless or being a drug abuser, whatever that may be. When we label people, we tend to see people by their label or their diagnosis, and not based on what they actually can do or can contribute. Because even the homeless gentleman can also know how to fix a water heater, so that when Mrs. Jones, who's 80 years old, water heater goes on the fritz, he has the ability to fix that water heater for her during the day. So the gifts of individuals, the gifts of the citizen associations, the athletic clubs, the churches, the block clubs, and the gifts of the local institutions, which in many cases may be beyond just their services they deliver. It may be a meeting room, the use of computers, a whole host of other things that may be available to help drive impact and results. And I'll talk about that a little later in the webinar as well. So the consequences of asset mapping, when we shift our focus from just looking at needs to also looking at assets, we have a much better ability to make change, because it's about a shift in power. It's about inclusiveness. All people have gifts and talents, and we have to recognize that. So our goal becomes, how do we unlock those? It's about relationship building. It's about people, not programs, build power. It's about welcoming the stranger. Again, when we label people, we tend to focus to them as strangers, and I'll talk about that a little later. It's about that learning community atmosphere that we talked about earlier. It's about place-based, one neighborhood at a time, and a cooperative orientation. So again, we certainly don't want to be Pollyanna. We have the data. We know that there are issues and concerns and problems in neighborhoods or in families or individuals. But what we're trying to do is unlock resources so that we can be more effective in the work that we do. So let's talk a little bit more now about the principles of asset-based community development. But while I'm starting this, if you do have any questions about the differences between needs assessments and asset mapping, please feel free to type them in the question box, and I will respond to them. And I'm going to talk a little bit more about how specifically to do asset mapping in a few minutes. But first, let's talk about the principles of asset-based community development for effective and community engagement. So what is ABCD? For those that are not familiar, it again starts with the simple truth that everyone has gifts. Everyone has something to contribute to their community. And I have a question about how do you identify gaps with an asset-based approach? Again, it's a balanced approach of looking at the issues or the gaps. You may want to do that because you may need to know, are there enough programs or services in a neighborhood and a community? And I'll talk about that a little later. But it's about, it's not that you don't identify that information, it's just that you're only doing half of the equation. You need to focus on the other equation as well, which is the assets or the resources that we have to employ. So again, it starts with the simple truth that everyone has gifts. It's the belief that neighborhoods and communities are built by focusing on those strengths and capacities of the citizens and associations that call the community home. So how do we begin to do that? How do we, again, the simple adage is, what can we do with what we already have to get what we need? Rather than waiting for somebody from the outside of the neighborhood to bring something to us, how can we begin the work with what we already have? It is, for the most part, a place-based approach, focusing on the assets of identified geographic area, whether that's a community, whether that's a neighborhood, because it is much easier to engage the work of people if they have to just go next door. If they had to get in a car or in a bus and travel for an hour, it's not going to be as easy for them to utilize and share their resources. But if they just have to go next door, go down the street, go a couple streets over, they're much more apt to be engaged. It is a belief that the assets of a community's institutions can be identified and mobilized as well, so that they can go beyond just delivering service. I have another question about, can the geographic area be as big as a county that has lots of neighborhoods in it? Absolutely. You may want to start one neighborhood at a time and build that up. But again, I will talk a little later about how do we identify the geographic area that we're focusing on. And finally, there are a range of approaches and tools, such as asset mapping, that can be put into practice to help this work occur. So let me talk a little bit, just for a few minutes, about what are the ingredients of a healthy community? What are we trying to unlock? What are those resources? And based on the work that John McKnight and Jody Kretzmann did before they wrote their book, Building Communities from the Inside Out, there are 5 ingredients of healthy communities. Healthy communities tend to have these 5 ingredients. The first one is people sharing their gifts, people being involved, people watching kids in the neighborhood, reading to kids, doing a whole host of things that are neighborhood-based, and people sharing their gifts. The second one is the association life, being involved in the neighborhood or the community. And associations are where people come together voluntarily because of something they care about or a passion. The most largest example of an association is the faith community. People go to church, synagogue, temple because of a passion for religion. So that's a great example. And in healthy communities, that association life of those churches, faith communities, are involved in the life of the neighborhood. But that also includes Rotary, Kiwanis, Seroptimus, men's softball leagues, whatever that may be. Just to give you a quick example, the men's softball league that plays softball every Wednesday night, and then they go to the bar or the tavern, if you will. In a neighborhood, the neighborhood knew that they were having some problem with the kids beginning to do some pre-gang activities. So they went to the men's softball league and said, one Wednesday a month, instead of playing softball and going to the tavern, would you work with kids in the neighborhood and teach them softball and then take them to the Dairy Queen? And the softball league said, absolutely, we'd be glad to do that. The only reason they hadn't done that before is that nobody asked them. So again, associations can play a huge role in the life of a neighborhood. The third ingredient is the institutional world, the nonprofits, business, and government, playing a role of supporting neighborhood development, supporting engagement, supporting the sharing of gifts, as well as delivering service. And I'll talk about that a little later as well. The fourth ingredient is using the environment effectively, whether that's the climate, whether that's a vacant lot, whether that's a park, using the environment effectively to help support the neighborhood. And finally, the economy, the time and money exchange in the neighborhood. How can we use that effectively to help drive stronger results in a neighborhood or a community? And let me just give you a quick example from the work I did in Mesa, Arizona, in a neighborhood where they identified that they had the issue of hunger. And again, this is where the needs assessments and the asset mapping come together. We worked with ASU's School of Nursing to have nursing students go into a different neighborhood every semester and do a health assessment. And typically when professionals do health assessments, they just share that information with other professionals. So we were helping to teach the students to how to share that information with the neighborhood residents themselves. So one semester they did an assessment in this neighborhood and identified hunger as an issue. So they went to the neighborhood leadership and said, we identified hunger as a major issue in your neighborhood. So using the asset-based approach, this neighborhood said, okay, what can we do with what we already have to help address the issue of hunger? So it's not about going to the food bank, it's not about getting more people registered for food stamps, although that's still clearly a strategy we want to employ, but the neighborhood said, what can we do with what they already have? From that, they identified a couple things. One, we live in Mesa, Arizona. We've got a great climate, a great weather. We could actually start a community garden and raise produce year-round that could help families have fresh produce in their homes. And so they looked at where are we going to do that? And they identified that one of the agencies in their neighborhood, they actually had a detox facility in their neighborhood. The neighborhood didn't need that service. They didn't need the detox service. What they needed was their nice vacant lot that they owned right next door to their building. And that vacant lot happened to be irrigated, so they actually could have a community garden and have it irrigated for almost nothing. So they went to that agency and said, could we borrow your lot for our neighborhood garden? The institution, the agency, said, absolutely, we would be glad to do that. This was also the first activity that brought out the Hispanic males in the neighborhood, because the next gift we needed were all the people that knew how to garden. So the garden began to grow and develop. There were businesses in the neighborhood where they went and got donations for the seeds and the tools that they need, and those kinds of things to start the community garden. So utilizing all of these assets, this neighborhood was able to launch a community garden to help develop that issue, or help address the issue of hunger themselves without looking for the outside to help address that issue. But one of the side stories of this, one of the gentlemen's Bill was the local neighborhood homeless man. He'd been labeled as a homeless man, been labeled as the stranger. And as you know, what we tell kids is stranger danger. So but as the garden began to move into fruition, Bill got closer and closer to the garden because he was checking it out. He was interested. One day he got close enough that one of the adults there said, "Bill, get away, stranger, get away, stranger danger. We have kids here." And Bill said, "No, no, no. I'm a third generation farmer. And my dad grew up on a farm, my grandfather grew up on a farm, I grew up on a farm. And if you would just move those rows, instead of doing it the way you are doing it, move them 90 degrees, you could actually grow more produce." And with that comment, Bill moved from being the stranger to becoming the master gardener for this garden. So that's how, again, we can begin to use gifts and skills and abilities in the neighborhoods that we work. So effective communities look inside first to solve problems. Relationships are seen as power. They have a good sense of their assets and capacity, not just needs. Leaders open doors, citizens are involved, and people take responsibility. So the 3 acts of community engagement, how do we begin to do this? The first one is we have to have a way of discovering everyone's gifts and passions. Once we've discovered those in a neighborhood, in a community, we then need to be very purposeful about asking them to share their gifts. Because people have gotten, I don't want to say lazy, but we've gotten sort of used to letting government do things, let agencies do things. So we have to become very purposeful about asking people to get involved and asking people to share their gifts. And then the last key, which is key ingredient, which is critical, which is to connect people with the same passions to act collectively. And I'll talk about how to do that in a few minutes. But the essence of this is discover, ask, and connect. And one of the key parts of this is how do you engage people to create care? And that's being very clear that everyone has gifts and everyone has passions, things that they care about. So the key is asking people to share their gifts around their passions. Typically what we've done in the past is recruit people to do our to-do list and then wonder why they're not showing up, wonder why they're not being motivated, rather than asking people what they care about, what their passion is, and then ask them to become active on that. So whether it's because they care about kids, seniors, animals, whatever that is, reading, then ask them to do something and become involved around their passions. And our experience is once you do that, you just have to get out of the way. You don't have to continue to try to motivate them to be effective. So using the power of asset mapping and other community engagement tools. So through this effort of asset mapping, of taking the time to find out about the gifts of people, people move from being just consumers of service or advisors of community programs to producers of their own and their community's well-being, because that's our goal, is how do we help everyone have an opportunity to become a producer. And the way we think about that is there are 3 roles that people can play, and they're all important and critical roles. The first one is a client, a patient, a student, people as recipients of service. And when they are a recipient of service, the professional knows what they need. So it is about clients' dependency, the agencies and funders in control, and it is about service, not care. The second role is advisors. I think we've gotten really good to see people as advisors for institutional action, so that we do ask people, what do you need? How would you like us to deliver the service? But it's still about clients, dependencies, agencies and funders in control, and still service but not care. But at least it's more informed service, which I think we all agree is critical. The last role is that of producers, co-producers of their own and their community's well-being. And in this case, the question we ask is, what can you contribute? So not only what do you need, but what can you contribute? So then that's what leads to resident engagement, and this is where we have now care, not just service. So our goal is to see how can we unlock these opportunities for people to play all 3 roles. because we need everyone if we're going to build a strong community. So asset mapping derives from approach to community building. It's a range of approaches that work from the principle that a community can be built only by focusing on the strengths and capacities of the citizens that call it home. So it's not just another name for resources. It's not just another, again, assessment. It's a strategy to identify assets that are available from the community and engaging the community. So let me give you an example. This is from some work I did with the Maricopa County Health Department. And this was an issue where the health department identified that they had, through their needs assessments and their data, identified that they had a problem. They had an issue of infant mortality disparity between African American and Anglo babies in South Phoenix. But the health department also knew that they had enough service in South Phoenix. They had enough clinics. They had enough hours of clinic service. So it was pretty clear to them that the issue wasn't just service, but it was also that they needed to find a way to create care. So they launched this initiative in South Phoenix to begin to do the asset mapping and begin to start developing care in South Phoenix. So what we did is they hired me as a consultant to help them do that. And so the first thing we needed to do was what I call create a resident leadership team. Create people that can be involved in the leading of this effort, because I do believe if you're going to do asset mapping, if you're going to do community engagement work, the people that live in the community need to be in the leadership position, not the institutions. And one of the first ways to do that is create a resident leadership team. One of the easiest ways, or one of the best ways I think to do that, is to go into the community and work with the associations to begin to find some potential leaders. So in this case, because it was an African American community for the most part, we went to the African American churches to begin to find some people that had a passion for three things. The first one was a passion for their neighborhood and their community. Two was a passion for the issue of infant mortality disparity. And third was a passion to go to meetings, because you do need, because the resident leadership team does have to meet in meetings. One of the things I like to highlight, one of my kind of principles or golden rules, is that you never want to judge the success of anything by how many people attend a meeting, because all you're really measuring is how many people that have a passion to go to a meeting or attend a meeting. What you want to look at is how many people are sharing their gifts. But in this case, we needed the resident leadership team. So by doing that, we created a resident leadership team of about 8 to 10 people. So we brought them together, and the next step is we need to select the geographic area for action. As we were highlighting, it's kind of hard maybe to start in a whole county or a whole issue, or even in this case, all of South Phoenix, because South Phoenix is rather large. But what they did identify is, so I asked them, what is the area you want to be responsible for to start with? We can grow the area later after you've got some expertise and after you've had some successes. But what area do you want to be held responsible for right now where you all currently live? And based on that, they identified this neighborhood basically from 20th to Central and from Southern to Baseline. So that was the area that they were willing to begin to create activity and action. Again, doing those three words we talked about earlier: discover, ask, and connect. So the next thing I asked them to do then was to do an asset map of the neighborhood. What are the assets that we have available to be used? So we put a big piece of paper on the wall, we drew this map, and I asked the resident leadership team to begin to map the assets. And typically what we do in the first map is we begin to map the institutional assets, because that's what most people are typically used to dealing with. So we had the agencies: a church, a store, a school, an agency, the local SNAP food stamp office, another school, a store, another church, an agency. And it was very clear they were doing a great job of mapping the institutional assets, but where are the assets of the residents? That is typically harder for us to think about, because we haven't thought about those things in this way, about connecting people to act collectively. So we now had to go to the next step, which is mapping the assets of the individuals that live in the neighborhood. So where we started was the resident leadership team developed a questionnaire. Typically that's what we do. We develop a questionnaire to go talk to people or hand out a questionnaire or an interview schedule. So they developed this questionnaire. which asks individuals where they lived and what are the gifts, skills, and abilities you're willing to share in the neighborhood. What do you care about? What is your passions? What associations do you belong to? And who else do you know in the neighborhood? So the resident leadership team developed this questionnaire. They were ready to go and start interviewing people, getting ready to walk out the door. Then all of a sudden they said, whoa, wait a minute. We're afraid. We're not sure we want to go interview people that we don't know. And the resident leadership team was primarily older African American women, so they didn't want to just go knock on doors where they didn't know people. And I said, you're absolutely right. One of the rules around this is you never want to interview someone you don't know or someone that you haven't been introduced to. Because, again, if you interview somebody you don't know and you haven't built a relationship, you're probably not going to get very good information to start with. So it doesn't make sense to do that. All right. I have another question. First of all, so I have two questions. One, I'll try to speak up a little bit. I do apologize for the volume issue. Number two, we have tried this in the past. The problem we encountered was finding volunteers to do the interviewing and then tabulating the information. That's absolutely right, and so I will be answering that question here in just a few minutes. So again, the goal is to never interview someone you don't know. So what we started with, and part of the reason for that is, again, we're not going to get good data, and it just doesn't help drive that action. So what we started with was asking the resident leadership team to all interview each other. So they interviewed each other, people they knew, so then we had a starting, in this case, of 5 interviews. Then we asked each of the resident leadership team to go interview 5 people that they already know, 5 of their friends. So each of the resident leadership team went and interviewed 5 of their friends. Also then, they asked those 5 friends to go interview 5 of their friends. And through that snowballing, we ended up very quickly with about 100 questionnaires that we could begin to map. So that's the next step is, and nobody had to interview anybody that they didn't know. So again, I don't think it's a very good strategy just hand out questionnaires or send them to people or have them go online. You want to have that face-to-face conversation because it's about engaging people to share their gifts, not just categorizing the assets or their gifts or their problems. So it's important that you sort of do that face-to-face to begin to develop those relationships. So the next step then is group and map by passions. Because again, you have all that information, all those gifts, those are going to be hard to map. So you don't have to map the individual skills. What you're mapping are the passions because it's about connecting people with the same passion to act collectively. So we use that wonderful invention on the map of colored sticky dots. So we had the colored sticky dots, so children were red, people that cared about seniors were yellow, people that cared about the issue of hunger were green, and people that cared about crime and safety were blue. So this was the starting point for this effort of looking at these, of mapping these. So now we went back to the map we had on the wall, and we began to map the assets, the people that cared about kids, about seniors, about hunger, and about crime. So as we did that, we began to map their assets, and then we can look for connections. These 3 people up here cared about kids, so we could introduce them to each other and ask them to do something collectively, whether that's doing a book drive, reading to kids, whatever that is. These folks cared about hunger, connecting them. They were the nucleus for starting a community garden in this neighborhood as well. And so you can go through and begin to map those groups and make those connections that's so critical. In addition, you can begin to look at the map and see, gee, in this quadrant, the lower left quadrant, we haven't identified anybody. We need to be more purposeful now about asking people that we've already interviewed, do you know anybody that lives on Darrell or on Park Street, so we can begin to make those connections as well. So again, asset mapping, how do we begin to do this? Create a resident leadership team, select a geographic area for action, draw the first asset map, identify the individual's gifts and passions, draw the second asset map, connect people with the same passion to act collectively, And in between all of this, take time to celebrate. Celebrate each step of the process, because we start with small steps which grow to larger steps as we're moving forward. So to help do this, what is the role of institutions, of funders and agencies and governmental entities if we're going to be successful in doing this? As I like to describe it, institutions should lead by stepping back to create space for citizen and neighborhood action. So we have to be very purposeful about looking at what we do and find those things that we can stop doing to create space for citizen action, because we don't have to do everything. So the 5 strategic questions are, first one is, what functions could neighborhood people perform by themselves? Again, there are many things that institutions are now doing that neighborhood residents could perfectly well do it, and it wouldn't cost us a penny. Quick example of that, if using an early education strategy, we decide one of our goals is to make sure that in a neighborhood that has kids, that there are 10 age-appropriate books in every household that has kids. Typically, our response to that is to fund it, to find an agency, to fund a program, write a grant, to do that in institutional world of turning it into service. The fact is that in every neighborhood, there are 2 or 3 families or parents that would be more than willing to start the book drive, to run the book drive, to make sure that there are books in every house in the neighborhood. And the fact is, we do not have to spend 1 penny to do that activity, because that's a perfect example of something that neighborhood residents can do themselves. So be very purposeful about what are those things that people could be doing themselves. What functions can neighbors achieve with some additional help from the institutions? How can we be helpful working together to help the residents be even more effective? And what functions must institutions perform on their own? There are clearly some things that only institutions can do. And I'll talk about a couple of those a little later. But again, if I break my leg, I don't want my neighbor to set my leg unless they're a doctor. I want to go to a hospital or to a doctor. If I have cancer, I want to go to a doctor. So there are clearly things that only institutions can do, and we need to be clear about. The 4th one is, what can we stop doing to create space for resident action? So again, once we've identified these things, what can we stop doing that we're now doing so that we can create space? Because we have to create that expectation that if the people don't do it, it won't get done. If people don't become involved, it won't get done. And the 5th one is, what can we offer to the community beyond the services we deliver to support resident action? So this becomes, for me, the 5 key strategic planning questions that agencies and funders need to answer if we're going to be effective in creating both care and service in our communities. So let me give you a couple examples from the United Way of Tucson and Southern Arizona where we put this into play as an agency, as a funder in a local community where we tried to grow both care and service. The first one is a family violence prevention initiative that we launched, and the second one was that we help support is the Neighbors Care Alliance. I do have a question around involving youth, absolutely, and I really should highlight that. I mean, one of the key goals of this activity should be for the resident leadership team to look at how we can involve the various segments in the neighborhood, including youth, including seniors, including others. So absolutely, we need to find ways to create this and make this as inclusive as we can. So that is a great question. Thank you. So the Family Violence Initiative, we decided as part of our health strategy to look at the issue of family violence prevention. So we went through the kind of those questions and looked at that and realized that to really reduce family violence, which in family violence we defined as child abuse, spouse abuse, and elder abuse, it was clear that we had to have institutional action, service, and also care, because there are things that neighborhood residents, neighbors can do to help reduce violence in their neighborhood. There are also things that only the institutions can do. Again, the neighborhood could be involved in doing training for people about violence and trying to do those kinds of things, prevention activities. But if a woman needs to get out of a violent situation, we don't want her going just next door to an unsafe safe house. We want her going to an institutional shelter or being involved with the police or the courts. So there are clearly roles for both as we move forward. So that's important that we look at both care and service as we begin to do this. So what we did is we, again, based on the research, the data, we knew crime statistics, we knew violent statistics in neighborhoods. So we began a process of sharing that information with some key neighborhood associations to identify a couple pilot neighborhoods that wanted to begin this process. Again, we didn't have to do it for the whole community, the whole county, just finding a couple neighborhoods to start with so that we could grow the circles over time. And April, I'll address your question in a few minutes around the youth. So again, so through that effort, we looked at and identified a couple neighborhoods that wanted to begin this journey with us. And so with that, we began to talk to the neighborhood residents, talk to the neighborhood association, which may or may not lead this effort because the neighborhood association itself probably didn't have a passion about reducing violence. But within that group, there may have been 2 or 3 residents as well. In the neighborhood, there are probably people that care about this issue. So through that, in these 3 neighborhoods, we created a couple of resident leadership teams that were willing to begin involved in this effort to see what they could do in their neighborhood. So based on that, we had an initial meeting, and we brought together the 3 neighborhoods and the resident leadership team. We brought together the law enforcement and courts and the family violence agencies. So we had literally all the right people around the table at this meeting to begin to address the issue of family violence. And based on that, then at the meeting, I started the meeting with something called the asset or gifts exercise. And what I asked people to do was on a yellow piece of paper to write all of their personal gifts or assets that they're willing to contribute to this effort, whether that's running a meeting, whether that's cooking, driving people to the meeting, driving, whatever that is. Just list all of your personal gifts that you're willing to contribute to this. And then on blue pieces of paper, ask the institutional people, to the agencies and government, to list on there what does your institution have to offer beyond the services that you deliver to support this action. Again, whether that's meeting rooms, computers, whether that's their staff to cook meals for meetings, whatever that is. And then on green pieces of paper to ask the institutional providers again to list their institutional services, their family violence services that they offer, whether that's law enforcement, shelter, counseling, whatever that is. And then we had everybody first go up and list their personal gifts, and we literally have them put them on the wall. And we literally had a huge wall covered with all the personal assets and gifts that were being willing to be contributed for this effort. And then we had the institutions come up on the next wall and share what else beyond their services they were willing to commit. And we had a wall of about half the size of the personal gifts. And then we had the institutional providers go up and put the green pieces of paper on the wall, which are the actual services that they delivered. And as you can imagine, that was the smallest wall, the smallest list. So again, it was very clear as we began to do that, as we have a whole host of assets that we could align and unlock to address this issue of family violence in these 3 neighborhoods. So that's how we began the process. So now we could begin to look at how do we use all of these. So the question then is, how do we begin to use all of these assets effectively to reduce family violence in these neighborhoods? Again, to address the question, do you change the questions for youth? Again, not necessarily. I don't think you have to change the questions. You just have to make sure that you are valuing their answers, I think, is the most critical issue, is that being very clear to the youth in the neighborhood, the youth in the community, that we need your engagement just as much. For example, the youth may be the ones that are really going to do the technology to help track some of these sticky dots or track the engagement if you want to use technology or other things. So I think the key is not necessarily to change the questions for youth, but just being very clear that you respect the youth, and just as much as Mr. Jones down the street, you need Olivia's gifts to be successful in this effort. Now another quick example, the Neighbors Care Alliance in Tucson. One of our other initiatives in health was around helping more seniors stay independent and active and live in their own homes longer. And to do that, we know it takes both care and service. So the other issue is in Tucson, as in many communities, we had a lot of people retiring to Tucson because of the weather. And the family would move, the husband and wife, and they'd move from Peoria, Illinois, and then at some point one of the spouses would pass away. And all of a sudden we had a senior living alone in our community, but their support system back in Peoria, Illinois. So what we knew we had to create in every neighborhood and in every congregation was that connection of engagement. So we had a formal process that we worked with Pima Council on Aging and others to help launch, to literally make sure that in every neighborhood and every congregation in our community, they had a formal process to identify all the seniors living alone in their neighborhood and all the people in the neighborhood that had a passion for seniors that would be willing to provide care. Take them to the store, take them to the doctor, cook them a meal, clean their house, walk their dog, whatever was necessary to provide that care so that they could stay healthier longer and not have to resort to institutional service, whether that's a nursing home or expensive care for the things that the neighborhood residents can do themselves. Because again, the neighborhood resident probably can't bathe them, have to have a professional come in and do that, but the neighborhood certainly can do a whole host of other things to help care for that senior. The other thing we did that was critical was making sure that those seniors that they were caring for also had an opportunity to provide care to another senior or other seniors. Because again, remember that social connectedness is so important. So one of the seniors we're caring for, they may also have a job of calling another senior on the phone every day or walking next door and talking to them, whatever that may be, because we ask them to be involved as well as asking the other neighborhood residents. Again, not everybody, just those people that had a passion for caring for seniors to become involved in that effort. So that's just two examples of the kinds of activities that you can do to help launch this effort and create both care and service by focusing on not just needs assessments, but knowing the data, but also asset mapping and engagement as a strategy. So let's talk a little bit about technology as we end. We have just a few more minutes in this effort, or this webinar. So again, one of the things that there's a book, another wonderful book I recommend called Getting to Maybe, How the World Has Changed. And that book, written by Francis Wesley, Brenda Zimmerman, and Michael Patton, they talk about that there are three kinds of problems: simple, complicated, and complex. And in the case of simple problems like baking a cake, simple recipe, follow the recipe, few ingredients, you get a wonderful cake. A complicated problem is like sending a rocket to the moon. Rigid protocols, but it's still a large recipe. Just has a lot more ingredients, a lot more steps, but if you follow them all, you will get to the moon. A complex problem is raising a child, and that's because the environment changes, the variables all change as it goes on. So as you know, if you have two kids, you raise them exactly the same, they end up totally different. And that's because raising a child is a complex problem. The world in health and human services that we revolve in really are complex problems, not complicated problems. So that's why it becomes necessary to have timely data that we can make the mid-course corrections. We can't assume that everyone getting exactly the same service modality or the same number of hours of counseling or whatever that may be is going to automatically come out with the same level of outcomes. We have to have the flexibility to make mid-course corrections. So if something's not working, we can change it and modify it. And so that's why technology becomes so important, because technology can facilitate that collection of timely information. It can help you streamline your grant making process so you have more time to devote to community engagement and care. It can enhance communication between your agencies and partners and improve your ability to get results and tell your story. So with technology, agencies can submit their information when you need it, monthly, quarterly, or semi-annually. It can be submitted in a uniform format to facilitate effective analysis to make those mid-course corrections. And you can roll it up to the strategy level. And agencies see their information used by funders. Without technology, I think we all remember when I first was an agency director, I would submit this year-end report to my funders on paper, and I knew it didn't do anything but end up in a file drawer somewhere because it was very hard to use that data effectively. Now, if you use technology, agencies can see their information used so that they can begin to see and become part of the solution and work in partnership with funders. And then finally, agencies have additional real-time information that they can use to improve their programs. When you're using data, though, just a couple comments. First of all, we need to make sure that data has the right communication power. Data that you're collecting that has communication power. And what we mean by that is that funders and donors understand the data. It really tells the story. That's why, again, in dealing with the education issue, high school graduation is such a good data point because it has such strong communication power. Everyone understands what that means. When you talk about high school graduation or dropout rates. If you talk about how some student did on the XYZ test, they scored a 200, people don't automatically know what that means because they don't know the scale. They don't know if 200 is good or bad. The second one is, does it relate to the community-wide impact strategy, the work you're trying to achieve? Does people see that aligned with what you're trying to achieve? Third, you do not need to report everything. Data travels in herds, so you don't have to collect everything, just look for those lead horses that really have the largest communication power and relate to your goals, and collect that data and report that data. And finally, make sure that the data you collect is collectible and replicable. You don't want to spend a lot of money collecting something that now you can't do a year later or 2 years later. So look for things that are data that meet these goals but are easily collectible and replicable. And so here's some examples, again, utilizing data to find out the residents' gifts that you could then put it into a database so that you could effectively use it. If you're collecting data on graduation rates, you can, again, enter that into the data system. And again, I'm showing you just a couple things, reports generated by CTK's software for funders. If you want to track, again, from the school district, community-wide data, looking at the number of youth served in the agencies, looking at demographics of individuals served, and looking at outcomes. So you can actually track the outcomes and results so that you can roll those up into the strategies that you need to support. And then finally, being able to dashboard your work. In this case, an example of this was the number of kids that did better on their post-test and learned new skills. You can dashboard your results so that you can better tell your story through technology. So let me stop now and see if there are any other questions, because we have hit the hour. And yes, somebody again asked, I will be emailing the PowerPoint to everyone at the conclusion of the webinar. In addition, I will be it is being recorded, so you'll be able to download the recording if you'd like as well. So please again go ahead and ask any questions, and as you sign off, please take a few minutes to fill out the survey. That survey is really important for us, important for me to help me fine-tune webinars into the future. So please, you will see a survey when you log off, so please take a few minutes to complete that survey. So at that point, I want to thank everyone for joining us today on this webinar about the difference between needs assessments and asset mapping. I hope you found it helpful. And I'd love to talk to you if you have any other further questions or would like to have any additional information about the issues and topics I talked about today. So again, thank you all very much for joining me. Please fill out the survey and have a great rest of your week. Thank you.